My name is Janessa Ruiz with Bernalillo County, and I'm here today talking with Cade. Tell me your last name again.
Arnink.
Arnink. Okay, and he's here to relay to you guys, the public, some of the things his organization does to help out the community in Albuquerque and Bernalillo County and New Mexico abroad. So let's go ahead and just jump into it. First off, thank you for joining us today. But can you let's start off with sharing a little bit of information about your organization.
Yeah, so I work with an outpatient clinic called the ASAP program. That's the Addiction and Substance Abuse Program. It's based within the UNM healthcare system. And it we want to offer comprehensive treatment for any and all addictions. And so in-house we have primary care, counseling, and case management. And we want to offer this to as many different groups and populations as we can. So we have specialties for adolescents, children, families, pregnant women, people who are struggling with more severe mental illness. We want all that treatment to be in-house, one place, so that your doctor can communicate with your therapist and your case manager, and all that care is just right there.
It's quite a bit of things right there.
Yes.
Now, if you could dial it down to just letting us know what exactly is the mission of of your organization.
The mission is just to provide care to the Albuquerque community and try and reduce the barriers to receiving that care. You know, it's a struggle when you're trying to, kind of get your life back together, to get into treatment, when all these different services you need are in many different places. And so by having them all in one location, we really feel that we can reduce a lot of the barriers that people struggling with addiction face when seeking treatment.
So how did you become involved in this organization?
So I was hired to be the clinical research manager for a trial we have going on at the ASAP clinic, focusing specifically on opioid use disorder, where we're researching ways to help get people into treatment for opioid use disorder and maintain them on treatment for opioid use disorder. And so we follow people for 2 years, and we have a special team of doctors who are just dedicating their time to the study and really just trying to provide an additional level of care and learn more ways that we think can eventually help the wider population, both in Albuquerque and nationwide.
So who would you say would be the best candidate to reach out to you guys to seek out your guys' help?
So I guess there's two veins to that. Anyone who's seeking just treatment and addiction, definitely reach out to the UNMH clinic. And people who are specifically looking for treatment with opioid use disorder and are looking, and might have, struggle. One thing that's nice about the study is, we provide medication and the medication management sessions, meeting with the doctors, free of charge. So for people who are low SES or who lack insurance, they can still get a high level of care and treatment without having health insurance, and we can provide that through the study.
Can you maybe tell us about some of the success stories that you've seen since you've been working with UNM ASAP Clinic?
Yeah, so I've been with UNM ASAP since February. That's when the study got started. And so since then, our longest running participant now has been with us for 22 weeks. And in that time, we've seen people who are coming off the street. They've been using fentanyl. One of our patients, they've been using fentanyl for, 10 years now at this point. And, after a few weeks of working with them, we're getting them stable on medication for the first time in a few weeks. They're moving into a new house that, where they're not facing, the same access as they were in their previous apartment. Their family is coming to support them for the first time now that things are getting better. They're feeling a lot more support from their community. They're, feeling more hopeful about the future than they were when we were first talking to them. And with most of our patients who are actually coming in, people are coming in, they're getting jobs, they're wanting to work on their families, be there for their kids, and we're really seeing people being able to take the steps to start doing that in their lives. Yeah.
Well, that's amazing, and it sounds like you guys are doing a lot of good work in our community. But for anyone who's interested in finding out more about you guys, what are some of the best ways that the public can connect with you?
Yeah, so the public can connect with the ASAP just by reaching out through UNM's website. There's information about all the services that the clinic offers. Just find that in the clinic directory of UNM, or just searching UNM ASAP Clinic, and that's ASAP. And then also reaching out to the clinic, calling, getting an intake appointment, or if being interested in the study, reaching out to us on the study directly. And yeah, so the ASAP clinic is the phone number that I should know. It's 505.
Well, on that,
Yeah.
what we'll do is
Yeah.
we'll put all of the information
perfect.
for UNM ASAP Clinic down below. And if you guys need any kind of help, please feel free to reach out to them at any point in time. And again, Cade, thank you so much for joining us here today. We're at the Fentanyl Summit. This is the first year that we're going to be doing this, or that we've done this, and was held downtown at Civic Plaza on October 13th. So we're so glad that you came out here and you guys are providing this service to everyone. And I hope to see you around. It was great meeting
Thank you. It was great to meet you as well. Thank you for doing this.
You have a
Glad to
good
get the
one.
word
All
out.
right.
You as well.
And remember, everyone, don't forget, stay safe.